Speaker, my question is to the Minister of Health and asks, how many reports of drug and alcohol rehabilitation or treatment centres closing down or considering closing down has he received since becoming the Minister of Health?
The Honourable Jonathan Coleman.
On behalf of the Minister of Health, I am advised that I have received some official reports of drug and alcohol centres under financial pressure. I have received no official reports regarding the actual closure of drug and alcohol rehabilitation or treatment centres. I can advise the member that funding for these services comes under mental health funding, and that mental health funding has been increased by around $174 million over the next 4 years.
The Honourable Clayton Cosgrove.
Has the Minister of Corrections ever advocated to him to retain or increase funding for the St Mark's Adult Drug and Alcohol Treatment Centre in Blenheim and the Care NZ Clinic in Otahuhu that are threatening to close down?
The Honourable Jonathan Coleman.
On behalf of the Minister of Health, I'm not able to advise what discussions there have been between the Minister of Corrections and the Minister of Health, but what I can tell that member is that I'm advised by the relevant DHB that the contract for 2 extra treatment beds at St Mark's Adult Drug and Alcohol Treatment Centre is not being renewed. That contract was pro rata at $56,000 per annum, or $90,000 for 15 months. However, the Ministry of Health has since November 2009 funded 1 social detox bed for methamphetamine users at a cost of $42,000 per annum. In relation to Care NZ, I'm advised that Care NZ in Otahuhu has been running an alcohol and drug treatment service for many years, receiving around $250,000 per annum, surprisingly enough funded by the HUT DHB. I am further advised the HUT has given this funding to the 3 Auckland DHBs who have advised Care NZ the contract due up in 2010 will not be renewed. The intention is for the 3 DHBs to provide services differently, though I do understand Counties Manukau is approaching Care NZ to provide some services locally, but at a different level.
The Honourable Clayton Cosgrove.
Does he agree with the Minister of Corrections that drug and alcohol problems amongst offenders are best dealt with in the community rather than in prisons? If so, why has he discontinued funding for the programs such as St Mark's Adult Drug and Alcohol Treatment Centre in Blenheim and the Care NZ Clinic in Otahuhu, both of which have been providing successful community rehabilitation services for offenders?
The Honourable Jonathan Coleman.
On behalf of the Minister of Health, well, I think I've explained the situation quite clearly regarding Care NZ and St Mark's, and there's no question that ministers have a united position on this matter.
Iain Lees-Galloway.
Supplementary to the Minister, does he agree with the statement from the Minister of Corrections in the House yesterday that other Ministry of Health funded services will pick up the slack from the St Mark's closure? If so, how does he expect Marlborough DHB will manage when its mental health budget decreased by nearly $650,000 between last year and 2010-11?
The Honourable Jonathan Coleman.
Well, look, I'd have to check the Hansard to see what was said, but it's quite clear that ministers have a united position on this, and the overriding fact is that an extra $174 million over 4 years is going into mental health. There's plenty of money available for services, but DHBs are having to make reprioritisations within that.
Question number 11. I beg your pardon, Rahui Katane.
Thank you, Mr Speaker. Supplementary to the Minister. Is it appropriate for DHBs to be competing by taking the funding from existing successful services and utilising the funding to help prop up their own budget, as is the case with the Waikato DHB, and what can the Minister do about it?
On behalf of the Minister of Health, it is up to DHBs to find the best value for the funding they receive. Contracts are not renewed or are ended for a variety of reasons.
Question number 12. Number 11, Dr Paul Hutchison.